allergic to penicillin. And even though we had discussed it on rounds, it wasn't updated on her chart. So I double checked her record and it wasn't listed on it. So I informed my seniors and I asked her again about her allergies, and I went back and reviewed and corrected her report. So yeah, I appreciate the lesson I learned. I'm glad I.
That's a very complete answer.
Yeah, I loved Dr. Shruti's
I was
answer.
just concerned if it was, is it a little long? Because I'm not really sure how I can shorten it though.
You can just practice it more, otherwise it's a good answer. Like it shows you know that you learn from your like not exactly didn't do any mistake, but yeah, you have a good learning capacity and you're a keen observer as well. So I don't think it's a very long answer, but you can just practice it more and you can just tell it briefly, otherwise it's a very, very good answer.
Okay, and would this be a good example for this question, or should I think of anything else? Because
See, no, Dr. Shruti, see, every answer is right. No answer is wrong, right? It's not something that you should be doing a clinical mistake that harmed the patient at the end of the day. It's something that you did. It's something that you did a mistake and you realized and learned from it. That's how we have to answer that question.
Okay, thank you.
That's like I feel it's that's how it should be answered. Otherwise, anybody just can tell. This is I'm even inexperienced, so I don't know. I can just that's just my opinion. Yeah. So, Dr. Kash, do you have an answer to this question? Or Dr. Sarthak? Anybody else who wants to answer this question? We still have to.
Yeah, so Ayushman, I just have like a rough draft for this answer. So this was like, I mean, I would like to start off this saying as like in the phase of learning, we are bound to commit mistakes. And one such incident was like during my surgical rotation during my internship. When I was instructed to give a normal incision to the patient, I had given a deeper incision than required. And later during the closure, I just placed the wrong type of suture on the patient, which I had to recorrect it after just taking the patient back into the operation theater, and it was a big hustle. So this is the example that I have on top of my head. Yeah, you can just give me a good feedback on this.
So, as Dr. Kash, in my opinion, like just taking the responsibility on your own when it comes to suture, and you have to take that back. You have to take the patient back to the OT. So it doesn't that is kind of a blunder, right? So instead of just taking the responsibility on your own, you can just say it was a team of 3 doctors. One was the first year resident, and like 2 of us were the interns, or something like this, right? So that kind of the responsibility becomes shared instead of taking the whole responsibility on yourself. Like that's
okay. Yeah.
And then
thank you so much for that.
Inform the patient, and the patient was a little bit furious, but we realized our mistake and we apologized to him. And then after some time, he was okay with that, like something like that, or that also you can just add.
Okay. Yeah. Sounds great. Thank you so much.
You were saying something to this answer.
Can I add something?
Go ahead, Dr. Rahana. Yeah, go ahead.
Yeah, so I encountered a patient. She was diagnosed with urinary tract infection. So it was during my internship while I was doing my medicine rotation. So I prescribed the patient trimethoprim sulfamethoxazole, but the fact is I didn't check her allergy history. So like after prescribing the medication, I went back to see the other patient. Then suddenly I realized that, oh, I forgot to check the history of the drug allergy or something. Then I went back, and then I found that she has sulfur allergy. Then I changed the medication immediately, and yeah. So and I also informed the nurse regarding this, and also like I told the patient that for mistakenly I did this and I corrected the medication. So that yeah, so that's how I want to say that from this experience, I always I became more aware of to pay close attention to all available data, and yeah. So and I also want to what should I say in the last that I'm like little bit confused, like how should I end this?
What I want to say is whatever mistake we're saying we did, it shouldn't be something very as in very big, so that they
Yeah.
won't think we'll do the same thing when we are there. You get what I'm saying? So like making, especially medication, is a big one. You get what I'm saying? So maybe someone should just look for something, especially drug interaction, all this allergy, is a really big thing. So I would
Right.
rather maybe look for something else as in another example that would not put us into that bad light. You get what I'm saying? Seeing us as maybe we will not be competent enough when we start the program.
So like we shouldn't tell anything but regarding the medication or something like that, as you.
Medication, we are going to deal with a lot of, as in that, prescribing medication to patients during
Right.
residency. So they
Right.
shouldn't see that as maybe obstacle for them taking us into, because they might be looking at us that, oh, this person making this kind of mistake. I hope we won't make that same mistake during residency. Though we want to try to be sincere enough, as in that was what happened, but all the same, we still have to put ourselves in that good light in front of them so that they would not have
Yeah.
any bias.
Okay. Thank you. Thank you.
Yeah,
But
you're welcome.
doctor, just I think since we're admitting that we did this mistake, even though I agree, it's a big mistake, especially when it comes to drug allergy or drug, interactions. This is really a big mistake. But since we're admitting that this happened during med school and we're aware of it and we're like really more careful, I think this could be a positive point in our interview, but still, I agree with the idea of this is a really huge topic. Maybe we can choose another kind of things, but still, admitting the mistake and saying that I'm more wise now. I'm more careful when I'm taking the medication. Like history and those kind of things. I think this would be a positive point in our interview. I'm not sure if you agree or not, but still maybe we can find something less dangerous, to mention.
Or maybe we can just talk about during our internship or during our medical school, because it's very obvious at that time you're under supervision. You don't do
Exactly. You wouldn't really prescribe something and nobody would look at it. A lot of people would review it before you submit it.
Absolutely, that's what exactly. Instead of saying that I was prescribing it to the patient, you can just write I was writing, since we don't have electronic medical record in our country, I was writing orders on a piece of paper or maybe a file. But yeah, when my patient reviewed it, then he told me that
exactly that would have been better. Maybe when
like
somebody senior reviewed it and told you that this.
Absolutely.
That's what I was watching a video of Dr. Usman Ali on the YouTube. He, answered this question. I think he's a resident in US. So he told that you have done a clinical mistake, it's fine. But how you learn from it, that's, it's important. You tell that clinical mistake and you tell that how you learn from that mistake. So it's fine. But yeah, instead of just saying during your college, just say during my internship or during my medical school when I was under supervision.
Okay.
Right?
That makes more sense. Yeah. Thank you.
Yeah, Dr. Ramya, just go ahead with the answer.
I have a feedback with the previous applicant where he said that about the surgery techniques and they took the patient back to the OR. I don't think we should say that, because one of my mock interviews, when I said that, the mentor said that it's not good to say something like that. So they want to say something which is of not big impact to the patient, as you said. So I thought it will be best if he's not using it. Yeah.
Yeah, exactly. Even I had that point, but that's why I told him instead of taking the responsibility all on his own, he can just say we were a team of residents and 2 medical students or 2 interns, so that the responsibility is more on the resident, right? And then he can just add the point that I learned from this mistake, so whenever if I have to do the suture in future, I'll be more careful when I have to do it on my own. But yeah, Dr. Kash, you can just go ahead.
Yeah. Thank you so much, guys, for the feedback. It was one thing on top of my head. I'll just phrase my answer equivalently to that. Thank you so much for that.
Yeah, Dr. Khan, do you want to answer? Yeah, Dr. Ramya, do you have anything else to add?
So I asked the same question. So I was telling about an interaction. So I was doing my residency in OBGYN. This is what happened. So there was a nurse who called from the ward and she said that I just gave a test dose of Ataxim and I do see kind of a bump. So I said, okay, let me tell the provider and then I'll get back to you. But I went to the OR and I got scrubbed into another case. I totally forgot about this. But the nurse, she gave the full dose, and when the patient came into the OR, she was fully with anaphylaxis. So when I said that, they said no, they don't want to hear this because they think that you won't be able to handle multiple directions or multiple patients on that day for you. So that's what I was just sharing with him as well, like not to use that.
But yeah, Dr. Ramya, that situation was when you were as a resident. Like your responsibility increases. That's what we are saying. Like that's what everybody said right now. We can just shift that incident maybe to an intern or a medical student when we are under a supervision, right? Because that's exactly the time when we have to learn.
That's true, but it'll be better if you're not bringing that to them because I think it's just a 20 minutes of a video call. They want to see the strengths, the positive aspects of it so that they can take us for a spot.
Okay, definitely. You could just come up with a better example also.
Yeah, true. Yeah.
So it's completely your interview and how you want to answer that. You can just go.
Ramya, thanks for this input. But can you suggest some examples from your side?
Okay, sorry. I want to give examples.
As I said, I'm just thinking about the same thing like this. If they want us to not to reveal the very burst impact, I'm just thinking about the dosage or even allergies, they can go to the extent. So it should be like a minimal thing. I made a mistake while it was also in the working time, but that was my beginning of my career. I did not write the dosage of the medication right, and the patient was going multiple places to the pharmacy because the dosage was not right. So I just created maybe a big difficult time for the patient at that time, but then I realized that my dose, what I wrote, was wrong, and so that's something happened. I think I can say that it doesn't have much impact on the patient side. So yeah.
Okay. So
can I chip in here, please?
Yeah, Dr. Samyukta, do you want to answer this question?
No. Just a quick point about all these procedural.
We have a lot of people lined up. Just be quick and give your point.
Okay, just about all these procedural errors, as all that has been mentioned so far, drug-drug interactions, anaphylaxis, all of these. The key is the way we could prevent it is better documentation and not relying on memory alone. So back in India or back in whichever countries we have worked so far, usually we used to use the paper format for history taking, wherein we have to recall everything. Whereas now we have either a printed format where specifically there is an option called allergies, and then we have to fill in that part. So it is rare to miss it now. If you're able to defend your answer on those lines, then it's okay, I believe. That's it.
Yeah. All right. Thank you.
Example. Even you can add now I use the proper format while taking the history so that I don't miss on anything. That could be a good point as well. That's what I even do. So Dr. Salahuddin, just go ahead with something you.
Okay, I want to give an example, but I don't know if it will work out well. So while I was working as a medical assistant here in the United States, I encountered a situation where I failed to inform the patient about biopsy site instruction before discharging the patient. So after discharging, I realized I didn't inform the patient. Then I had to call the patient to inform the patient about the biopsy site. Then I also ensured the patient understood everything that was discussed in order for the site to heal. And I also gave a written instruction as well. Then after that, I made a checklist to ensure that all necessary instructions and information are conveyed to patient before discharge in future cases. So I don't know if biopsy sites will be a good example or not.
Anybody wants to give feedback to Dr. Salahuddin?
Biopsy site is a good example, but again, if you're able to defend it that you did not have the checklist checklist at that point, because usually we are supposed to have checklists to check details of the patient and the site which we are going to biopsy, right? The right side, left side, which part, and all of it. So if you're able to defend your answer saying that till then there was no checklist available, but after this happened, a report was made and we created a checklist for all future cases, then it's fine.
Okay.
That's a good answer. That's a good way, yeah. So Dr. Usman, you raised your hands, and then we'll go Dr. Harshita, Dr. Nahid, and Dr. Arya. Yeah, Dr. Usman, go ahead.
Yes. No, Ayushman, I did not raise my hand.
Are you referring to me?
Yeah. I think that might be by mistake you raised your hands.
I want to answer. My name is Muhammad Usman. Yeah, we have like similar names. That's why.
So
yeah, he is also Usman. So yeah, you can.
Yeah.
No, it was OFMAN. Like, yeah.
Yeah, it's me.
Yeah, you want to answer?
Yeah, I want to try.
Go ahead. Yeah.
I'm not sure if this is a clinical mistake, but I'm going to say it anyways. So it was during my outpatient clinics. So we had a patient, a diabetic patient, and on that day I prescribed metformin for him. So after several days when he came to follow up, I realized that his blood sugar didn't drop. So when I asked him, he admitted that he didn't take the drug, and he admitted that it's due to his financial situation. So from that day on, I realized the importance of opening the questions on the social aspect of the patients about their financial situation and will they afford the drug and if they have medical insurance. So from that day on, that's what I usually do. After I conclude my talk to the patient, I open to talk to him about his social situation and everything related to his finance. Yeah, thank you.
Okay.
That's a very good answer. Yeah.
Yeah, that's a very good answer.
Yeah. It covers everything and not putting you at risk also. It's a very, very good answer. Yeah. Thank you.
Yeah, just before prescribing, we just have to look after the finances of the patients as well. So yeah, that's a good answer. Yeah, Dr. Harshita, you can go ahead, then we'll go to Dr. Nahid, and then we'll move to Dr. Alia. Yeah, Harshita, go ahead.
Surgery rotation in during my third year of medical school. The attending surgeon told us to go and take history and do physical examination on the patients. So I was assigned to one patient, and so after doing the history and physical examination, I went to present the case to the attending, and I had forgotten to ask the social history for that patient. So the attending physician told me it's very important to ask social history, regardless if you think that the patient might not smoke or drink because of their cultural because that's going to impact your treatment plan. So for surgery, for example, if they smoke, you should tell them to stop, counsel them to stop smoking few days prior to the surgery. So would this be a good example, to tell? Any feedback?
So Dr. Samyukta, Harshita, that's a very, very good example. And Dr. Samyukta mentioned, you can just say that what you learned from it, that after that, you just, wrote down, I just missed that word. You just wrote everything in order, like you made a template on your own, and then you after that you started using it because every part of component of history taking is very important. Be it whatever surgical, be it whatever clinical branch it is. So after that, while taking the clinical history, you made it very sure, you made it sure that you will use that template so that you don't miss any component. Like that's my feedback. Anybody else wants to say something?
Yes, template is the word. Template is the word for history taking, and checklist would be the word for surgical rotation.
Sorry?
Template would be the word for history taking, and checklist would be the word for clinical for surgical rotation.
Oh, that's a very good point. Thank you. Yeah. So, Dr. Om, the question is, any clinical mistake that you made, or like,
Yeah.
yeah,
Can
that's it.
I want to comment on what
Go ahead.
Dr. Osman said. A follow-up point, like if they asked us after, like when he said, like, okay, I learned that I have to ask the patient about their financial status before ordering medication or whatever, so prescribing medication. So should we, if they ask us, okay, if you ask the patient and there was a problem, with their financial status, how do you encounter this? Or okay, what do you do if all your patients are broke and they can't buy the medication? Is it like, what should we say? Should we say that we in the clinic we decided to have like a budget for those patients, or do we have like free sample medication to give these patients? Or you know what I mean? Like, should we be prepared for a follow-up question? Because this could be a question to ask, Yeah.
So I think like in US, what happens is that we have the social services. That's what I am doing CCS cases right now. So we have to advise the consult the social services for that. In many countries, we do have social services that help. Otherwise, we can just talk about the free samples also. And yeah, that's what you mentioned. Anybody else wants to add something to this?
Yeah, I want to add something. You can also say that sometimes they're a cheaper alternative for the same drug. That happens everywhere. They're very cheap alternatives. So you can give
Yeah,
it.
we can prescribe generic medicine, which would be cheaper.
Exactly.
Yeah.
That's what I
So
want.
the most important thing I hear is we can appreciate that what the financial status of a patient, and it's more important for a physician to know so that we know what medications are covered and not covered. So that way they know that we are very much interested in patient care, which is even though basic, it's very important.
Exactly. And it goes not only for the medication, knowing the financial status, it goes for like further stuff, for other things that we would help the patient with. Okay, perfect. Thank you so much.
So Dr. Osman, instead of saying that metformin, you can come up with a little more expensive drug. Right?
Exactly. That's the metformin is really cheap. That's what I wanted. This is really, that's why if you want to prescribe any other medication, it would be not cheaper than
SGLT2 inhibitors you can just say dapagliflozin, or I don't know, I don't remember. I have to just work on that as well. So you can just come up with that, and then you can say that since he couldn't afford that, so we shifted the medication to a metformin, which is comparatively cheaper.
All right, that's a good idea. Thank you.
Yeah. So Dr. Nahid, you can just go ahead with the answer.
Yeah, thank you. Actually, I'm not quite sure is it a good example, but this is what I remember. You can tell me. During my previous work in Saudi Arabia, I was working as internal medicine resident. I admit with one patient with sickle cell crisis, pain crisis, and it's non patient for us and having her own file in the hospital. And I ordered morphine for her. And it's not non-allergic to anything, but unfortunately, this patient developed allergic reaction. And when I asked, she said over the last 2 years, when not coming to our hospital, she developed a morphine allergy. And it come to my knowledge for the first time that patient can develop secondary allergy. And it's such kind of pseudo allergy, this non-immunological reaction. And fortunately, it's not a serious one, and we can control it. But it like become it's routine for me to ask patients for allergy, even not mentioning their file that they are allergic or something like that. It's like a routine question that since that time I ask to every patient, even it's known for me that it's not allergic.
Okay, so Dr. Nahid, that's again an example that Dr. Ramya mentioned that since these can lead to a serious problems, right? So you have to think about it whether you want to mention it or not. Something just clicked in my mind is that, some this example happened with me, like during the blood transfusion. My resident was giving a blood transfusion, and I was intern in that time in the pediatric emergency. So she was just giving the blood transfusion, and she didn't. She actually matched everything, but I think she missed on the unique identification number we have. So at that time, luckily, I saw that she didn't match both this unique identification number on the file as well as on that blood bag. And then I just corrected her. But from that incident, it was a learning point for both of us. In spite of how busy is the emergency, we have to focus on every aspect of our practice so that we don't harm the patient. So in that way, I'm not taking a responsibility on my own.
Yeah, the point that this patient is not allergic to morphine before. This new developed allergy. It's not before. So that's why I'm wondering if I can mention that or not.
So like you can just, instead of saying, like, not in your example particularly, but that's just what I had in my mind right now, is we can just put it like a colleague had this similar experience, and it was not a clinical mistake that was done by me, but one of my colleague in that situation, and I learned from it. So it doesn't show you negative light.
I have something to say here, Ashman, because the question is what mistake you have done. I mean, the mentor also told me, like,
I have to ask even the patient. Yeah, I have to ask about allergy, because this patient know that she developed allergy over the last year for morphine. So I have to ask even the patient known for us.
I can just start with an answer, like my answer like this. So like addressing the doctor by the name. So I can just say I cannot recall an incident where I did a clinical mistake. But yeah, one of the colleagues in that situation was working with me who did a clinical mistake, and I learned from that. I could just begin my answer with that, because it's not necessary that I should be having an incident where I did a clinical mistake.
Okay. Okay. Thank you so much.
I would definitely work on that, but that's just an opinion. That happened with me, and I thought that I'll give this answer.
Yeah, that's a good one though. But sometimes I've heard people saying that when they ask you a question, and if you're going to answer it in a safer kind of way like this, they repeat the question, thinking that we're not answering the answer what they needed or required, because they want to see as a person what we did. I mean, we have all had a good amount of experience to be here, so we would have come across. So they are another side of the table, and they know how the candidates are. So it's one way of looking at it, is like doing a mistake and owning up it that's what they're looking up here. So I think my mentor also said you could say that your friend did it and it's about to happen and you prevented it. So something like that. But I don't know how far the faculties are going to accept it. Like, many people are different here. So I think you have to play depending upon the faculty that day. So yeah.
I could just have another answer as well in case they ask me like what mistake you did. So I could just come. Yeah, that's a good point. Thank you so much. Yeah, Doctor.
And I think it's okay sometimes, because a lot of people did not have any time to do any mistakes. They were like graduated and directly like applying to residency. Some of them haven't done any mistakes during med school or whatever. So what would be their answer to such a question? Maybe as Ashman said, like, maybe I noticed somebody doing something and I was involved, and I stopped it before it happened. I think this could be an answer if you have not any other thing to think about. You don't want to be in a bad situation answering it in a really highly dangerous way, and then like you miss something. So that's it. I don't know, my opinion, but still, yeah.
But yeah, and at the end of the day, I feel even if you commit any mistake and that doesn't harm the patient, like that, it's fine to mention. Like, even if you talk about allergies and you didn't ask,
absolutely,
at the end of the day, it's not going to harm it didn't harm the patient, right? So you learn from that incident.
Yeah.
Right. So that's because that's what I heard on YouTube. But yeah, again, I'm not a very experienced person in that, since this is my first season. So yeah, we can come up with the better answers for sure. Okay, so before moving to Dr. Arya, then we'll go to Erica, and then we'll go to Dr. Ali. So yeah, so Dr. Ramaswamy just mentioned something in the chat box that, before prescribing antibiotics to a female for UTI, she missed a point of asking about her pregnancy. And the attending later on pointed out to just ask before prescribing any medications. So how would that, to avoid any teratogenic events by chance? So like, how's that example for this question? Anybody wants to comment quickly?
I think that's a good one. I feel it's a real good one. It's very specific, and he's giving importance to women's healthcare and is looking at the patient as a whole. I find it's a really good one. It's my opinion. Thank you.
Okay. Yeah, instead, yeah, that's a very good, and you can just frame it in a way that I was in my OBGYN, like as a medical student, maybe, or you are as an intern, that would look even more better, that you are open to learning new things. Yeah, so that's a, like for me also, it's a good example. So yeah, we'll go with Dr. Alia now. Yeah, go ahead, Dr. Alia. Then we'll go to Erika and Dr. Ali after that.
Well, I need your honest opinion about this. Well, I'm a dermatologist in my home country. I'm now applying for internal medicine and family medicine, and I have interview in both of them. So I don't want this answer to backfire on me. So I have a little few scenarios. I'll tell you all of them, and then you decide which is better. Number one was a patient with dermatitis herpetiformis and celiac disease. I prescribed them Dapson, and I also asked him to do CBC every month to check for his any hemolysis. 2 months later, the patient came to my clinic, and he looked very pale. And when I asked him, why didn't you come a month ago, and have you done your lab? And he said that I'm good. I just didn't think that it is important to this lab work, and so. When I checked his lab at the clinic, he has severe hemolysis, and I stopped Dapson. And at this time, I realized that it's important to emphasize on the patient when prescribing such medication, the importance of doing labs, the importance of follow-up, and make sure that as the patient really leaves the clinic, that he understand well the circumstances of everything that I have prescribed or asked him to do. This is scenario number one. Scenario number two, a patient with acne. I prescribed her anti-acne treatment, and I explained to her the way she should apply the medication. A week later, she came to my clinic with her face with irritant contact dermatitis. Unfortunately, she thought that the more she put the cream, she will get better sooner. So despite the fact that I explained this to her, this is what she did. So at that time, I decided that I have to spend more time explaining the nature of the disease and the way of application of treatment and the consequences and complications that would have happened if the patient applied the medication in an appropriate way. The third example is one of my patients who had hidradenitis suppurativa. I prescribed her kind of few medication in the prescription, but the patient, because of financial issues, she decided to choose just one of these medication, and unfortunately, she developed the complication because of she didn't use the other medication. So I learned that I should have asked the patient more about her financial issues and make sure that she's able to bring the whole medications and the management plan to get the optimum care and achieve cure. So I'm not sure which is better to say for internal medicine, which is better to say for family medicine. Are these okay or not? I'm just asking for your opinion. Thank you.
Anybody wants to quickly give a feedback, because we have 2 people in line and we are short of time?
Hi, sorry, Dr. Alea, I just want to ask you something that is a bit unrelated. So I heard you say you're a dermatologist in your country, and I know that here in the US, dermatology is a standalone department. Like you go into the residency directly. So questions may want to arise, like, why don't you want to go to dermatology? Why internal medicine? Excuse me, I'm just saying it because I'm also a dermatologist in my home country, and I've had a lot of people ask me, okay, get ready to answer this kind of questions, and they're going to come up. And in my own country, you must do internal medicine first before you sub-specialize in dermatology. I don't know if it's like that in your country. How is it like?
Well, it's another question. I have been prepared. I've been preparing for this. In terms, my experience is quite unique. The true and honest answer for me would be, because I'm applying only for the programs that is present in the city where I live with my family.
Sorry, Dr. Alia, I'm so sorry to interrupt you. So tomorrow we can specifically talk about like the ones who are going to change their specialty. We can just start a session with this point, that why you want to change your one specialty from one to other, and we'll have the new perspective as well.
Okay, Dr. Ishmael. I just wanted to make sure that she understands that part. Okay.
Tomorrow we'll just take
tomorrow.
we have Dr. Ramya and Dr. NG. You can just join. We can. Because I'm seeing you after a long time here. Nice to see you.
Oh yeah. I was busy. I was busy with step 3 exams. Sorry. Thank you.
So I can have a private discussion with doctor. Using the WhatsApp group. No problem.
So the exam, Dr. Alia, you told, according to me, it's very good that you may that from this you realize that you have to make sure whether the patient has a better and has a complete understanding of the treatment and even the pathology of the disease. So for me, it is a very good example. And in that way, you're even talking about your experience as a dermatologist in your home country. That's what something you have mentioned in your CV as well. Right, so according to me, it's a good answer. Yeah. So yeah, before Erica, and then we'll move to Dr. Ali. So the tomorrow first thing we'll do is somebody who's going to change their specialty. We can start with that question, right? And then we'll take the question like, what is the most important decision of your life? And then we would move to some third question which you can post in the group, and we'll take it up here. Yeah. So Erica, you can go ahead with your answer.
Yes. So I also thought about one answer just now. So this is during my intern year when I was posted in surgical rotation. I was helping my residents working up with the pre-op patients, and I worked up a patient who was posted for laparoscopic cholecystectomy, and I did my took thorough history and clinical examination. I presented to the resident, and next morning the whole team was there, and I was presenting to my team, and later we realized.
I come from a multicultural background, and I believe this.
Sorry. Can I go on? Yeah, so I'll just continue. So later on, during my presentation, the whole team realized that patient's ALP level was high, and because of that, and nobody noticed it, not the residents, and it was missed by me also. So the patient's surgery got delayed, and that was a teaching moment for me, because now I know that even if I'm taking some responsibility, I have to look at everything, not just history examination, what I'm being told to. And now I'm more vigilant when it comes to working up a patient and looking at everything, not just what I'm told to do. Yeah.
That's a very good example, and yeah, it's a very good example at the end of the day. Like I think somebody even mentioned about this example, like they had a similar experience, so it's a very, very good example. So Dr. Ali, you want to go ahead with your answer, because we're running short of time, so we have to cover maximum people.
Okay.
Anybody has any feedback to any of the those who spoke right now? You can just write in the chat box. Dr. Ali, just go ahead with your answer. Go ahead.
Okay. In one of my early clinical rotations during my internship, I made a mistake by misjudging a patient's condition that led to unnecessary tests being ordered. And this experience emphasized to me the importance of seeking guidance from seniors, colleagues, and work as a team to improve the patient condition. And since then, I have made a priority to enhance my clinical skills and collaborate closely with the colleagues to ensure the best care of our patients.
Can you repeat your answer again in briefly, like?
Yeah, when I was doing my internship during early clinical rotation, I made a mistake by misjudging a patient condition. I did order like unnecessary tests to a patient, and I know that by one of my colleagues, he said to me, this can be done by other way. You can like decrease the test. You will order initial tests, like non-invasive tests firstly, and because of his advice, I like step back, and I did order like the initial test first, and after that I realized that the importance of seeking guidance from senior colleagues when in doubt, and acknowledging when I don't have all answers. Since then, I made a priority to enhance my clinical skills and collaborate closely with my colleagues to improve the patient care.
That's a very, very good answer. So I think you can just frame it in a way. But you have to talk about what internship means in your country, because as internship in the US is a first year residency, internship in our country is not the residency at all. Still, we are a medical student. So you just firstly expand on that, and then you can say that, I ordered the tests. But then when I showed it to my residents, or to my first year resident, at that time he told, then he explained you that, if you do the invasive test first, it puts a lot of financial burden on the patients firstly, and secondly, the patient has to go through a lot of pain. So instead, we first go for the non-invasive tests, and if we are able to make a diagnosis out of that, then we won't proceed to the invasive ones. And in that way, the patient will have less financial burden, plus he won't have to go through unnecessary pain. And that's what I learned, and now I make sure that whenever I do the test, I just go through the first line investigation first, instead of jumping to the diagnostic tests.
Okay, thank you.
That's a very, very good example. Yeah. So Erica, you want to tell something? You just raised your hands.
Yeah, actually, Dr. Osman also posted the same thing. It's a very good example, Dr. Ali. But if you can just mention the condition and make it more relatable, if we know the condition, it becomes more relatable. So it would be better. Otherwise, very good example.
Okay, thank you.
That's very, yeah. Go ahead.
Yeah, like just you told a couple of seconds ago that internship in this country, just want to confirm, in this country, the internship is a part of residency, and like home country,
The first year residents are called as intern, like where whatever clinical branch you practice, the first year is, I think it's common to everybody that you have, in spite of you going to surgery or radiology or any other branch, the first year is common. Like we need to have the postings in these particular subspecialties, or different, that's actually common, and it's
but I thought it's PGY1. This is how people say. I am in PGY1.
PGY1 is the intern year. Like they are called as interns, but not in our home country. We like in India, being intern is a medical student. After that,
so while telling, okay, so we have to be specific that
Yeah.
what we mean by internship, to like we have to explain
when
them.
Being an intern in US has more responsibility on you,
Yeah.
right?
Got
And so it doesn't look nice that you are telling that, they don't know. Like they might think as the first year you did this blunder, right? Because they will.
So we can how to say that in India, like how we should express that in India internship is part of the graduation. Like
Yeah,
this is how.
you just say like internship is what I wrote. It's a 1 year of mandatory clerkships that we have to do after 4 years of a medical school, and after that we graduate. So that your answer doesn't become long, but they understand what being an intern means.
Got it. Okay.
It's a compulsory clerkships. It's 1 year of compulsory clerkship after our 4 years of medical school before we graduate.
All right.
So it means, so it implies that you are a medical student at that time. I think that's a very important point to tell them. Otherwise, they'll be confused.
It's a 4.5. Like one semester is 1.5 years. So if we after 4.5 years we
That
get.
you can just even after 4.5 years you can just but just make sure that you tell them what an internship means.
Got it.
Right. So yeah, that was my point. Yeah. So Dr. Arya, you want to say something? Then we'll shift to Dr. Muhammad, and then we'll end.
Yeah, I just have a question about mistake you made regarding the patient care. So could it be like a mistake in communication, like I brought bad news to the patient in unprofessional way? Would that work as well, rather than like going and address like
Go
some
ahead with your
clinical mistakes?
example. You can just go ahead with your example.
Do not have one in my mind right now, but maybe like
Yeah, that's again a good example. That there's nothing wrong in that. Like, if you quote an example that you told, you can just say like maybe in early part of your medical career, and that's how you learn. You know, everybody's going to commit a mistake.
Oh, okay.
So yeah, you
Perfect.
can just
I
have a
have
good example mentioning that. Yeah, go ahead, go ahead.
I have opinion. It's better we don't talk about communication skills because being an IMG, I think that's one of the biggest factor that they're worried about us. It's better not to touch on it unless and until if you don't have anything else to say. Maybe you could say something else which is not going to be have a big impact to the patients. But I think the communication skills, not following ethics, not following HIPAA, maybe even if it's the beginning career, I don't want you to project that. Even other person who said about the invasive test, yes, I totally understand. Yeah, many of us would have done it, but after going to a residency spot, I don't think we should project that because they're looking for a person who has done all the steps, who knows how to handle, and maybe not great in communication, but maybe above average. So if you're thinking from a program director and these are the things they might look in a candidate, so I think we should watch on to that and make sure that we are not touching on that. That's my personal opinion. So may differ again.
Okay,
Thank you.
Okay, that's a very good point that we need to keep in our mind. So we have Dr. Sooraj with us as well today. So we can have a closing note by him and then we can end the meeting. Dr. Sooraj, you want to tell us?
Yeah, I just got free from my interview yesterday. I had one.
Nice. Congratulations. I hope you
Thank
had
you. I mean, I'm satisfied, but I don't know if I could satisfy an interviewer.
So we'll just have like tomorrow we can discuss about if you're comfortable, you can just let us know your experience. Right?
Yeah.
Tomorrow.
Basically, you want to know it's now or tomorrow?
Tomorrow, like we can take it tomorrow because I think time is over. We can just, tomorrow we can have you and we can just have firstly begin the session with your experience so we can have the insight about the interview. Like we can just spend like more time, listening to you tomorrow.
I don't think so. Wait, I mean, these are the same things which we have already been discussing here, to be honest. I mean, so they mostly programs ask those same traditional questions. Tell me about yourself, your strength, your weakness. You just have to be ready that they can ask these questions in indirect way as well. Like yesterday, one interviewer asked me directly that tell me your strength and weakness. The other interviewer, he asked some traditional questions, tell me about yourself, your journey, okay, what you did after graduation. And then he was like, okay, tell me a thing you are horrible at. I was like, okay, let me think. So this was something he asked suddenly. And then I realized, okay, maybe I should talk about my weakness here. And then after my interview, I try to find on Google that if telling about your weakness and when the interviewer asked that tell me something when what you're horrible in. So is it good that you answer your weakness in that question? And Google was like, yeah, you can talk about your weakness whenever the interviewer asks you that tell me something you're horrible at. So you have to be prepared in such things. It's not necessary that they will ask you, okay, tell me your strengths. They can ask you, why should we choose you, or tell me anything unique about you. So just be ready to answer those questions if they are asked in indirect ways. Apart from that, they said that, okay, tell me about your home country experience and an interesting patient, why internal medicine, why our program. So everything was completely same as we have been doing here.
So yeah, Dr. Sooraj, how was the structure? Do you have, so firstly I want to ask you, do you have any, you can just briefly tell about what weaknesses you think you had and you mentioned about that?
So I just told him about one weakness because he said, okay, tell me what you're horrible at. Then I just said one weakness that I hesitate to I hesitate to ask for any opportunity because I felt like that someone will come and hold my hand to get me to that opportunity. But then I realized that the world doesn't work like that. You have to speak up for yourself to grab your opportunities. And with the time, I tried to speak up for myself, and now I do not leave any opportunity if there's anything for me. I'm the first person to take initiative for any opportunity if there is. So
You must have aced your interview for sure. Like I have seen your communication skills and they are the best. So you don't need to worry about that.
Let's see.
And the last one question is like, how was your interview structured? Like we can have an idea about that as well.
So the interview structure is same for everyone. I mean, they'll see the whole schedule for the interview. There will be some hospitals will send you 2 links, one for the meet and greet if it is taking place one night before the interview, and the others will send you just one link which will include everything. That means the meet and greet, everything will be taking place in that morning when you have the interview. I got 2 links. One was for meet and greet with the residents a night before the interview. The other link was for the interview. And the interview starts with program director's speech. He gives the overview for all the program, and after that, they send you in the breakout rooms. And in the breakout room, for example, if 3 persons are going in the breakout rooms, the other persons will be with the residents or with the program coordinator, and they'll have the chance to ask questions about the program. And when the first 3 persons or first 4 persons will get free from the interview, then you will be going into the breakout room. So it will be a continuously 3 or 4 hour session and program to program. My session was for 3 hours. First hour was for interview. First hour was for program director's speech, and then I had half an hour interview with associate program director. Then 1 hour I was out of the breakout room because my next interview was after 1 hour. After 1 hour. So in the meantime, I was in the open session in which program coordinator and chief residents were there. We had to talk to them if we had any questions or if you want to know about the city, about the program, activities are there. So you can randomly talk about these things. And then after 1 hour, they sent me in the breakout room for my next interview. After getting free from my next interview, the program coordinator asked me that now I can leave the meeting if I want, or if I have any questions, then I can ask. Otherwise, I can leave the meeting. So this is the whole structure. Whenever you are in the interview, they'll be sending you in the breakout room by themselves. Just make sure that after you are done with your interview, you don't click on end the meeting. You have to like exit the breakout room. So just make sure of that thing.
So we just have to press exit.
Yeah, I mean, when you click on leave option, so when you're in the breakout room, so there are 2 options: leave the meeting or leave the room. So you have to click on the leave the room.
Okay.
Yeah, make sure of that thing whenever you are. Even the program coordinator will also make you cautious about that thing. You have to leave the room, not the meeting, when you finish your interview. So overall, everything will be fine. And everyone here in the group who has been practicing here, you people are all very confident, and you have been things, you know about everything, that how you have to answer. So you all will do great in the interview.
And Dr. Suraj, like during the introduction session of 1 hour, there the program director gives that introduction. So we can just make points as well at that time, and we can just use that in our answers. Like why you want to choose our program. So we can use those points, like maybe the goals and everything. Though we have everything on the website, but whatever he mentions, maybe that is something extra, and we can use that in our answers.
So there are different things. See, if you have a meet and greet session, okay, in meet and greet session, you can ask the residents that tell me anything that is very special for the program, how the program is known about, what is that special thing. Then you can use that answer in your interview, that why you want to come to that program. And in the program director's speech also, you can write down some points that he has been talking about, that why you want to come to that program. If you have any personal connection, or if you know any resident in that program, you can talk that one of your residents has highly spoken of your program. But make sure that you tell that resident that you're going to take the name.
Right.
Sometimes they might ask you that who's that resident whom you know, and if they ask you the name, so they'll again confirm from residents as well that do you know this candidate. So you have to take in confidence the resident or anyone you know that if I your name, is it okay or not? Because sometimes it can counteract as well if you take the resident's name without telling them. So and the program asks the resident, do you know this guy? He was telling that he has talked to you. So, and if you haven't done so, so it can go against you.
Right. That's a very good point. Anybody else wants to ask anything to Dr. Sooraj before we end? Let's just go ahead.
Thank you
Yeah,
very
Dr.
much, Dr.
Sooraj.
Sooraj, for
I
the
just have
insight. Thank
one
you.
question for Dr. Sooraj. Thank you so much for like going into all of this, like, you know, like great, like great detail about like his interview. The only thing I wanted to ask is, I think like, I think right now still everyone is like, you know, preparing content and like it's really good stuff. But I think out of all of us, Dr. Sooraj is like the most prepared for an interview in terms of, you know, he has his answers framed, he's taken notes and everything. So I just wanted to ask Dr. Sooraj, do you have any like resources that like you learned from apart from, you know,
No, not really.
apart from this thing?
I have been using YouTube only, just
YouTube.
trying to frame my answers only. Just taking the template from them that what are the professional words that should be used during the interview. So apart from that, you just have to use those templates and put your story in those templates. And it's not like there's any perfect template, I would say. It's all about that how well you tell your stories by yourself. So yesterday, I remember before starting the interview, the program director was like, I want you people to be yourself during the interview. We do not want that you give us those scripted answers, what you are prepared for. So just be yourself. Otherwise, we'll get to know that your answers are scripted. So I mean, he was very right, because they have been taking interviews, and in one day they have been listening to 10 to 12 people, and if everybody is going to use the same template, so they'll get bored. So it's better you try to make your own templates, and then just check on YouTube that what are the, or maybe not on YouTube, even if you can just write on ChatGPT that tell me some buzz adjectives for internal medicine residency interview. Tell me some buzz action verbs to use during the internal medicine residency interview. So he'll give you a list of those adjectives and action verbs which you can use, and that you can impress your interviewer as well, because there are some buzzwords and catchy words that if you use them, so of course the program will think that this is a candidate who's really prepared for the interview, and he's not scripted.
Perfect.
Perfect.
And
Did you have any?
asked me
Sorry,
that
did you have any?
any behavioral questions. I was not asked any behavioral questions yesterday. They just asked that tell me any interesting case that you have seen in the United States. So we just discussed that one. There was how much interview you got, places, your score, blah 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 blah. Okay. I just have got one interview so far, and it was on very short span of time. I got it on Thursday, and they asked me to schedule it on Tuesday because they did not have any other dates for that. So unfortunately, I had to give. And yeah, it was from Texas, I would say. My scores, yeah, I don't mind sharing my scores.
Very good.
35, 60, 235 to 65 to 13. My year of graduation 2017. And yeah, visa requiring IMG. Okay, and did they ask you about the interesting cases in your home country? Yeah, they just asked me that tell us about your home country experiences, and they just asked that what was your home country experience and what were your duties, and apart from that, they asked that in the United States, tell us about any interesting case that you saw in the United States.
Wow.
And in that, we can just talk about, maybe we have done a case report or something. We can just talk about that as well. Like that would be interesting, and that's why we did a case report on that.
Yeah, of course. Case report means that case was very interesting.
Yes,
So of course,
we can just talk about that. Yeah, so we just strictly, Dr. Arya, do you have anything to add, because you raised your hands and because we have to end the meeting? Okay, Dr. Mohammed, you raised your hands. Do you have something to ask or add?
No, sorry. I forgot like to take it down. So
That's fine. Yeah. Then Samriddhi, do you have anything to add? You can just go ahead.
Yeah, I wanted to ask, what did you ask from the program directors? Towards the end, they usually ask, do you have any questions for me? So what kind of question did you ask?
So in one interview, I was just left with 5 minutes. So I mean, that was the best time because you just ask two questions, that's all, and your time is over. I read their both of my interviewer, they had publications. So I asked about their publications, and fortunately, when I visited on the website, so their awards and accomplishments are also written there. So I discussed with them that my first question was regarding their research that I just went through, and I asked some questions from that research paper.
What was the questions? What were those questions?
It was just regarding the research because it depends. Like if your interview is having some research, then you have to see the content and what question you want to make. So I had one research, and the patient had co-infection with bacteria and fungal infection both, but the initial culture grew just particular bacteria, and there was no any fungal growth on the culture, and they started the patient on antibiotic. But it wasn't, and after 1 month, they got to know that there was a co-infection of fungus as well. That's why patient wasn't improving. So my question was that, okay, so how did you get to know about it? And if he was on antibiotics, did his health improve or not after the antibiotics? And there was one more question as well from that research. So then he told the whole case that, yeah, he was not improving for 1 month, and that's how. That's what made us suspicious that if there's something else going on, they made another culture after 1 month, and that grew a lot. Sporotrichosis fungus was there. So then he told the whole story and said it was a very interesting case. I just saw this case for the first time.
It must be a case report, right?
Yeah, it was a case report.
Okay, perfect. Yeah.
But there were other researches as well. So I just went for his recent one because it was from 2023. So I focused on that one rather than going to the previous one.
So it was mentioned on the website only, or like, did you find it on the website only?
Yeah, this is a tricky question. So sometimes they mention everything on the website when you go to the program's website, and luckily I found all the researches in their profile. But sometimes they do not mention anything on the profile, and then you have to find it by your way.
Okay,
so,
like we can just type in the name in the PubMed.
Yes. So if you just write their name, so if they have any publications, they will just show up there. Second question I asked was regarding his. It was not his clinical awards and achievements. Everything was written in his profile. So I just asked that. I just told him that I found something mutual from your profile. You have won so many awards and you have so many achievements. And when I look at them, I feel it reminded of myself when I was in med school. I had the same achievements. So I would like to talk. I would like to talk to you regarding these achievements. How you feel like when you got these awards. And then, of course, both of the interviewer had the achievements, the same awards, which I won in the medical school. And then one of the interviewer was like, oh, I was really happy when I got these awards. And the other interviewer was like, I don't feel happy after getting these awards. So, I mean, of course, I asked the same question from both interviewer because both have the same achievements. But one was very happy that I received these achievements and I'm proud of them. And other one was like, I don't give a shit to these achievements and awards. So it was tricky. And the other thing, so yeah, for the first interviewer, I could just ask these two questions because the time was over after that. For the second interviewer, I asked these two questions. Even after that, there was 5 minutes left. And he said, if you have any other questions, you want to talk to me. I was like, okay, there are still 5 minutes. Why should I waste those 5 minutes? And then I thought about, okay, what should we talk about? Then yeah, I mean, at that time you have to think about any topic that you want to talk to. So my question was that because I asked him about his research, about his achievements, so I asked him that, okay, I would like to know more about you. Can you please tell me what do you do apart from medicine? What do you like? What do you do in your free time? Then he told me that, okay, I love cooking, I traveling, I have traveled to these places. And then from traveling, you can ask the next question, oh, really, you like traveling? I also like traveling. So what are your favorite places? Do you like to go to the historical places, or you do like adventurous places? Then the conversation started and it went on for 5 minutes more. So I guess, I mean, you can just continue in this way if you want to just complete your time. If you don't want to ask anything, if you have asked your 2 questions and still there are 5 minutes, you think that asking more questions can hurt you, or there are no any good questions that you can think of, you can just say, no, I don't have any more questions. That's it.
That's it.
Can I ask a question, please?
The conversation, then definitely ask. But if you think you are not good at it, you cannot continue the conversation, then just leave it.
I have a question, please. Regarding presenting a case, like, do we go in detail while talking about a specific case? Like, give them a detailed history, the assessment and plan, or how do you handle such question?
Yeah, so while I was doing my mock interviews with my mentors, so they told me that don't discuss the whole case, because sometimes you do not want to tell them the whole clinical scenario, because their opinions can be different from your opinions. So don't go in the details of the cases, just give a brief presentation. For example, 82-year-old man with the comorbids of diabetes mellitus, hypertension, previous history of a stroke, blah, blah, blah. He was a known case of this, or he was admitted with this thing. And I had a conflict with my colleague over his management. Don't tell that what management conflict was that, what medication conflict was that, because you don't know that if the next person would also go in the favor of the other person. So you don't take any medication name. You just say that while you were managing this patient for his complaint, you had a conflict of opinion in regard to his management or his medication. And to solve that conflict, you took the initiative to talk to your colleague. You went to him. You were very professional while solving this conflict, and you try to find out the root cause of that conflict, why we had the difference of opinion in the management. And if you were right, then you can say that you try to find the articles related to your opinion, or if the other person was right, then you can say that that person showed you the proof of the articles which were in the favor of that management. And this is how I learned that, okay, there can be sometimes difference of opinion, we should respect it. And we should always take steps to solve that conflict professionally and respectfully. That's it.
But we do not go in detail regarding like the specifics of the case, like the management, imaging, labs, and stuff. Just like very brief.
If you go in details, you never know the next person can ask you about those things, and you never know if he is also in the favor of the thing, that mistake you made, and he can judge you on that. So just don't go in details. Yeah.
Okay.
And
like,
a quick question. Oh, sorry, Mohammed, you can go ahead.
That's
Sorry.
okay. Well, just one last point. So, like, I was talking about like an interesting case. Does the interesting case need to have like a conflict with a colleague or a difference in opinion, or could it be just like something I learned from the case or something? What do you think?
Case could be if you remember any interesting case that you have seen first time in your life, or you feel like it's a rare case and you'll never see it again. So that could be the interesting case. Yeah, conflict is. I mean, if you wanna, if you have just one case that you wanna keep it for the conflict, for interesting, for difficult, for everything. If you keep one case and it's something different, otherwise, I will say that just keep something very different that you have seen during your rotations, or even if you have back home that you have seen something there.
Case was rare and you liked it would be enough.
I don't think so. Going in, if the management was really interesting, then you just talk about that. If the patient was improved with that management, and it was something, I mean, you didn't know about it, that giving this thing would improve the patient's condition, then of course talk about it. Like if it was something rare or something new that you haven't seen even in any literatures, then talk about the management. But if any proof is there for the management, like if the management, if the evidence-based medicine says something, but you tried something else, so then I would say don't talk about the management.
Sure. Thank you.
A quick question, please. You mentioned that you asked the interviewer what do they do in their like free time or whatever. Don't we consider this a personal question, or we can ask it if is it okay to ask such a question, or we should just focus on their website, or whatever those people did, or it's okay, to create I don't know, just take a good environment. I think that we can ask such a question.
Yeah, it depends on interview. If you feel like the interview is very strict and you feel like you cannot go with him in the conversation, then don't bring the topic. So I asked almost every question regarding the program. He completed his residency in the same program. He did his chief residency there, and then he did fellowship over there. Even then, he was staying in the same program. So I asked that, okay, after asking research question, award question, accomplishment question, and my next question was, okay, so I see that you have completed your residency, chief residency at that program. What is the best thing about the program that keeps you here in the same program?
Oh, that's a good point. Yeah.
So then he told me, oh, that's very good. I said that, tell me in just one word that what is the best thing in the program that keeps you here in the program? He said the quality of the program. I like the support system of the program. So, I mean, this is something that was brought up in the interview. After that, even there were 5 minutes more. And
okay, so it depends on how much time do you still have to create more questions, or the environment. How do you see the interviewer? And yeah, exactly. Okay.
Yeah, even before starting the interview, he told me about himself. He said, okay, before starting the interview, let me give a brief introduction about myself. He told about everything in his professional life. And at the end, he told me about his personal life as well, that married for 13 years, I have 2 kids, blah, blah. And he told everything. So that means he has always
He's open to speak. Yeah, he's open without discussion. Okay, perfect. Thank you.
Indu has asked, and Elisa has asked where we can.
Yeah, we have similar questions in the chat. So, like, where did you take mock interviews, or what paid agency helped you? Like, give us some idea that we can, feel.
I did not go for any paid agency, and I don't think so. We should go for the paid agencies.
No, you said something like your mock interview mentors. Who
I
were
mean,
the
that's only the seniors that I have. So I try to involve them in my mock interviews. So if you have anyone who's resident, you can ask them that if they can take your mock interview. Even if you are gonna interview at any places, I don't think so. No, don't ask the residents where you're gonna already interviewing. So just ask your senior residents, if you know any residents who are doing residency, ask them to take your mock interview. It was one of my seniors who took my mock interview. And even if you have done your observerships with any mentors, you can ask them to take your mock interview. They can also guide you very well. And we can also start continuing the mock interviews here at this platform, or maybe I'll see if I can make any group, then I'll let you guys know. Then we can maybe keep 2-3 hours for the mock interviews daily, and at least everyone can get a chance to do the mock interviews. So we can discuss on that thing. We can form a group, and we'll see take the suggestions from everyone in the group, that how can we go for the mock interviews. It's not necessary. I don't say that doing a mock interview with me will help you. I'll say that doing a mock interview with everyone will help you, to be honest. Because the more you do the mock interviews, the more confident you will get, and you'll get to know about your answers as well. When you're discussing your answers here, of course, we are giving you the feedback. You're getting feedback from all the 60 to 70 participants, that how you can improve your answer. But when you do the real mock interview, that's something when you get to know that how prepared you are, how prepared your answers are. Do you really recall your answers while you are giving the interview, or you don't recall them? So that's something which is very important. So if you have started doing mock interviews with friends and anyone, that's great. If you haven't done so, I'll advise you start doing the mock interviews. Otherwise, you might face some hard time during the real interview.
And it will be
Sounds perfect. Yeah.
what I feel is
Yeah,
over
sure.
here doing a mock interview would be difficult because I don't think everybody's comfortable speaking in front of 60 to 70 people every time. So you can just ask somebody in the group that do you want to go for a mock interview or not? Because I have it like with my friends on a regular basis. Like the people I know, I can just maybe like I'm not looking for the people for the different accents maybe so that I don't have a problem while understanding during the interview, right? So you can just go. It's not necessary that you have to do because when you are like even if I have to do a mock interview, I have done it with a lot of people. I've done it with Dr. Sooraj as well for sure, and he gave me a very good feedback. So, but it's not easy to do in front of 60 people. But yeah, you should just start doing it with yourself. You can just write in the group. Somebody wants to do a mock interview with me. Just go ahead. It just takes 30 to 40 minutes.
Yeah, that's what I we already
improves
discussed
your
as well.
answers.
Remember, okay, I would say that just keep few persons that you want to do the mock interviews with, like 3 to 4 persons who regularly see you that how you have been improving. If you are doing mock interviews with different persons daily, for example, today you are doing with Ayushman and tomorrow you are doing with me, then next day you are doing with Indu, other day you are doing with Alisa, and next day you are doing with Sapta. So in that case, you would be getting different feedbacks from everyone, but there will be no one to judge you that how much you have improved from first day. So just try to yeah, or if you're like keep one person who could be changing, but keep 2 to 3 persons who are constant, so they
Right.
can tell you that how much you have improved from your start till now.
So like I just had 4 mock interviews with my friends. Like one was Dr. Suraj and other 3 were my friends. So like 3 of them were really good mock interviews I had. But when I had it with my 4th one, it was it was not a very good mock interview for sure. Like the answer questions he asked me, I was not able to answer them, and I felt very bad. And then I realized that I like maybe somewhere I was overconfident from the first 3 mock interviews that I can answer everything very well. But from the 4th mock interview, I was like, no, I really need to work on my answers because that person gave me a different perspective.
Yeah.
Right. So
So
it's
that,
very important to do the mock
yeah.
interviews. It's like fine coming here, like we discussed, we can learn from the answers and everything, but for sure we can frame our answers in a better way. And plus, for me, sitting here in the front of camera gives me the confidence. Otherwise, I couldn't speak in front of so many people. But yeah, so that works for me. But yeah, also just take time, schedule the mock interviews with your friends. Apart from this,
If you are the same thing that when you do, I mean, keep 1 or 2 persons different. On daily basis, if you bring on 1 or 2 persons different who are taking your mock interviews, they will ask some different questions that you have never listened, and you can think about that. You can think about those questions. You can make up those answers, and keep 2 persons or at least 3 persons the same who are your constant. So then you
and
can work with them on those questions, then those new questions.
right. And I can use that opportunity. Like if I'm interviewing Dr. Suraj, like he interviewed me and I interviewed him. So he gave me a lot of feedback on my answers because my answers weren't that perfect. And when I had an interview, when I interviewed him, his answers were very, very good and well structured. So I didn't have much to speak and give a feedback to him. Right. But what I feel is we don't want to hear good things during a mock interview. It's good when people start criticizing you, right? Like my last interview, my friend, criticized me about my answers. And that's when I realized that, I really need to work on them because, like last 1 or 2 people, even Dr. Suraj gave me a very good feedback. And, my first 2 people, those who I did my mock interviews with, they, said a lot of good things about me. So that I think made me somewhere a little bit overconfident, but that shouldn't be the case. So you should just keep maintain a regularity doing mock interviews because doing a Zoom call is free, right? It's a free opportunity. It's just that you have to find somebody doing a mock interview.
Yeah, but it can we can just fix a time where everybody can come and we can send them in the breakout rooms like real interview happens. So in that breakout room, it's not necessary that you are getting the same person daily.
Okay.
So you got your daily changing person. For your personal things, you can keep your friends or other people with you, like 2 persons that will be your constant. But in the breakout room, you'll be meeting new people every day. And there's a RESIA group as well for the interview preparation. If you guys know about that, they have also interview practice on Friday, Saturday at evening time, and Sunday, I guess, morning time. So you can even join that RESIA group as well. They have, I guess, on their page, they are on Instagram as well, and they are on Discord as well. So they have their link. You can just join. It's a page, I guess, RESIA. You can just check on Instagram, RES. Let me just see the spelling.
Is it a paid one?
I guess RESIA.
No, it's a free one. It's RESIYA. RESIYA. Yeah.
Okay,
Yeah.
RESIYA.
Yeah, someone posted.
It's free. They give you like initial 15 minutes. They have the mentors if you want to discuss with them, and then they send you in the breakout rooms where you can practice. So you can join. If you don't join if you don't join within the 10 minutes, then they don't let you in. So you have to be on time for those sessions. But they are thrice a week, Friday, Saturday, and Sunday, and that's a great platform. Last year I did not use it. Even this year I haven't used it so far, but from this week I'm gonna use it because somebody told me that they had a really great time. So from this week, I'll be also going to use that platform. And I'm also thinking to make my own such platform where I can help for the Zoom interviews. So let's see.
Yeah. So that would be great thing. Like we can just work on that as well, apart from these meetings, because we just repeat here the questions every day. But yeah, definitely we do get perspectives to new answers because we have been doing that for 20 days more, and we have discussed most of the questions so far. But yeah, now just focus on the mock interview, and it doesn't take much time, but you get a lot to learn from them as well.
Yeah, I would say just practice very well for those 10 to 15 questions which are traditional. You know that every program is going to ask you those questions. Okay, no matter what, they are going to ask you those questions. Behavioral questions, 70 to 80% programs, they are not going to ask you about those behavioral questions. I'm sorry. Only the 10 to 20% programs are going to ask you those behavioral questions. You should be prepared for them because they are also included in those 15 to 20 traditional questions. But you should be more prepared for what are your weaknesses, your strengths, how you present yourself, tell me about yourself, your challenging case, any difficult patient, and why our program, why we should choose you, your experience, your internship experience, and if you have written any activities or any hobby, you should be prepared for those hobbies that you have to answer them. If somebody has if somebody has just written to show off, like I play chess, then you should be ready to answer that, to justify your hobby, because they can ask you anything in the interview. Like my interviewer asked me, I said in my free time I do cooking. He was like at the end, I mean, after asking 3-4 questions, he said, okay, you mentioned about your cooking, so tell me what do you like in cooking? Okay, what do you like to cook? So I just started answering that. So if you have given any hobbies that you are not aware of, so I would advise that please prepare yourself to answer that as well. Apart from that, you all are genius. If you have come so far, that means you all are capable of getting the residency. Just a little bit more hard work is needed. That's it.
Yeah. So we can just do like, I can create the breakout rooms tomorrow onwards here, and randomly they can assign, and you can do the mock interviews here as well. Right? Otherwise, you can ask your friends also to do the mock interviews and just go with, because they are going to help you now instead of just discussing the questions here. That's fine. Like I just like doing it because it helps to maintain the continuity. But yeah, I can just make the breakout rooms here, and you can just have the one-on-one interview session as well. Right? And randomly, if you have 60 people over here, it will randomly assign the breakout rooms. And that's how it can help you. Like if somebody wants to do, then that's fine. Otherwise, they can just leave that as well. But yeah, apart from that, you can just contact your friends, whosoever, whosoever I look up to, I just contact them for a mock interview. And yeah, that's how the things are going to become better for me. And I think it's going to happen. It's going to help everybody out. Just go and ask your friends for the mock interviews.
Yes. And that day, you remember we discussed about the of the answers. So I told you guys that I don't remember, Elisa was that, or who was that who had just a short answer, and somebody said that please try to elaborate your answer so that it takes 2 minutes at least.
It was like Alia or Lisa, yeah.
Lisa or Alia, who was that who gave a very good answer, and somebody said that it seems to be very short answer. So please keep your answers short, because during the interview you will be already telling a very long answer no matter what. So if you keep your answers very long before the mock interviews or during the mock interviews, then in the real interview it will be more longer. So if you concise your answers in 1 minute, then be ready that during the real interview it's going to take 90 seconds. So you have to be prepared for that.
Yeah.
So just try to concise it, because when you have the real interview, you'll talk more things with them. So try to concise your answers. This is the one advice that I'll give from my previous interview session. So yeah, even if you have tell me about yourself for 90 seconds to 120 seconds, just keep it till like that.
Right.
That's it. Don't try to stretch it on 4 minutes, because if you are stretching it in 4 minutes in the mock interviews, then in the real interview you are going to stretch it for 6 or 8 minutes.
Suraj, a quick question. So all those traditional, most commonly asked questions, I agree with you. Those are like around 10 to 15. If you have them, then could you copy paste on the our WhatsApp group if possible after the session?
I don't have the file for that, but I remember, Ayushman, you already sent the file in which there were all these questions in the group.
Somebody just shared. So into the questions are like Dr. Sooraj told, tell me about yourself. Then they'll shift to why US healthcare system, why you want to be a doctor, your weaknesses, your strengths, why should I take you into the program? And then after that, they might ask you like what element in the periodic table you can relate to, what element in the kitchen you can relate to, or maybe like they can ask you, explain me something in 1 minute. Or they can even ask you, see, firstly, they're going to start with the basic questions. And if you're able to answer that, then they'll come to some tricky question, right? But first,
I agree.
I
agree, but especially if you have ready, then copy paste on the WhatsApp.
I don't have a list, but yeah, I could just write whenever I get time. I just write in the group. I'll just write it today. I'll just send it in a group. Like I just know it verbally, so I'll just write in the group. Otherwise, a lot of people shared. If somebody can share in the group, just go ahead.
No, these most common questions really matter. Really sounds. And they are really common. And sometimes we miss common things and we go to the uncommon things.
Because nobody is going to start with like the interview with like tell me the most common element in the periodic table you can make. That would be the last question they're going to ask. Right? First, they're going to just try to know what is our personality and what is our thinking.
Yeah.
But onwards, I'll just create a breakout room automatically. If somebody wants to practice, they can go ahead with that, and the rest of the people can just be here and discuss the questions as well. Right? Otherwise, you can just go out with your friends also to practice, and that's how we can just improve our preparation for sure. Anyways, today's session was very, very insightful. Thank you so much, Dr. Sooraj, once again. So I'll just end the meeting right now, and yeah, tomorrow we'll meet with a new question. So first we'll take up the question that if somebody wants to change the specialty, why they want to do it. And then we can just shift to like, what is the most important decision of your life? And the third question, somebody can post and we can take that question as well. Right. Thank you so much, everybody, for joining, and see you tomorrow. And have a good day or night ahead, depending upon your time zone.
Thank you.
Thank you.
Yeah, thank you.
Bye-bye.